first thing is to really understand your personal risk, and broadly, the older you are, the higher your risk of cancer in general terms. If you're a smoker, if you're overweight, if you've got a strong family history of some cancers, that may increase your risk of cancer, but often not always. And if you drink more than the recommended guidelines, these are all things that could increase your risk of cancer. So the first thing I say is know your own risks, and then know your own body. People are aware of their bodies, and knowing when there's a change and that's unusual for you, but importantly, persistent changes. So if we were to talk about bowels, for example, many people's bowels change all the time. It depends on what they've eaten, how stressed they are, how much exercise they've had, how much water they've drunk. As GPs, what we're interested in is a persistent change in normal for you. And broadly, that applies to most cancers. And probably the most worrying symptom that worries all of us as GPs, if someone has persistent unexplained weight loss, is one of those things that should not be happening and definitely needs to be checked out. Then there's the skin lesions that aren't healing, or unexpected lumps or bumps or growths, and particularly if they're growing over a short period of time. Things that grow over a short period of time, it's really important to get those checked out.
So I think there's 6 ways that I would say that we could tackle this. So the most important is to stop smoking. That is the most preventable cause of cancer for all types of cancer. Is implicated in 70% of lung cancers. So definitely that would be my number 1. Number 2, try and reduce the amount of alcohol that you drink. We know that is implicated in a lot of cancers too. Try and maintain a healthy weight. Weight is implicated in endometrial cancer, as we've just heard, but also breast cancer and bowel cancer as well. Try and have a healthy diet. Try not to stay in the sun too long. That will increase our risk of skin cancers. And move as much as you can. So exercise. We talk about the importance of exercise, not just to prevent cancers, but also to reduce our risk of heart disease as well. There's so many benefits to that. So ensuring that we do get out every day and get some resistance exercise as well, and just keep moving.
The 2 probably main things are checking for breast cancer and skin cancer would be the 2 things that you're most able to do, because they're a kind of looking and touching thing. And so, for breast health, really, again, very important to know your own body. So to get really familiar with what your breasts look like and what they feel like. And the best time for women to do that is often when they're about to jump in the shower or jump in the bath. So take a moment just to pause and look in the mirror in your bedroom or bathroom, just to see if your breasts look, or what they look like if you're not really familiar with them, but to make sure there's been no changes in appearance. And the kind of things we want to know about as GPs is, does it suddenly look uneven? It's not the same shape as before. Normally that would be on one side more than the other. Is there any dimpling? Are there any skin changes around the nipple? Sometimes eczema over the nipple can be a sign of something more worrying going on deeper within the breast. And then what I tend to recommend women do is just get familiar with how their breasts feel often. So we all wash on a regular basis. That's a really good time to feel your breasts and know how they feel, because especially with the water and the soap, it's a really smooth surface. And I tend to recommend people when they think about examining breasts, women often worry that they don't know how to do it. And actually breasts can be hard to examine. The glandular tissue, they're not smooth. They're not meant to be smooth. And if you feel them with kind of a poking motion, everyone's breasts will feel very uneven. So it's about imagining that I try and tell people to imagine a kind of a Ziploc bag of jelly, and you've hidden a marble in it, and you're trying to find the marble in the jelly. You wouldn't go like that, because you'd keep losing it. What you'd do is you'd press it against a flat surface and run your hand. So it's the same kind of process with examining your breast, pushing the breast tissue against your chest wall with the flat of your hand. And what I try and reassure women is that if there is something abnormal there that is very worrying, it's highly likely you might find it, because they're not very subtle. So it might feel like a small hard pea or a cherry or a stone. The kind of lumps we expect women to find are quite different from normal breast tissue. But if you find anything that makes you worried, even if it's the same both sides, then come and see the GP. Let us examine you, let us have a feel. And sometimes it's a case of, especially if you're still having periods, come back after your period and we'll examine you again. But if there is a lump there, then absolutely we should be looking into that with either a mammogram or an ultrasound scan, and your GP should be making that happen for you. And then mole checks, again, quite simple, looking at your skin, being familiar with your moles. And when we're thinking about melanoma, we're thinking about moles that change rapidly over a period of 6 to 8 weeks, growing, crusting, bleeding. And being aware of that, sometimes even taking pictures of it and then going back a few weeks later and taking another picture, maybe with something to reference the size. That can be a really good way of reassuring yourself it's not growing over that period of time. But the same message, if you're worried, go and talk to someone else, share the worries, and then you can explore whether anything else needs to be done.
There's no specific evidence to say that we should avoid certain foods or have more of certain foods at the moment in a particular type of food, and we'd worry, maybe that people would become deficient in certain nutrients if they did avoid food groups. But having a healthy diet, lots of fruit and vegetables, high fibre, trying to avoid some processed foods, because we do know that that is linked to bowel cancer, and red meat as well, so keeping that to a minimum, but making sure we get lots of those good proteins, so our white meat, our chicken, our fish, and our pulses and that sort of thing is a lot better for us. So we do say for men and women to try and have less than 14 units of alcohol a week. It doesn't matter what type of alcohol it is with regards to your cancer risk. And it also doesn't matter whether that's spread out or whether it's sort of binge drinking as such. When we're looking at cancer risk, I mean, it's obviously different in other circumstances, but from that cancer risk point of view, it's just staying below that 14 units a week.